Oh, I just bit my tongue. That was a lot hotter than I expected it to be. Hey everyone, my name is Dan. Welcome to the channel. If you're new here, I'm a first year Doctor of Optometry student at the University of Melbourne in Australia. And in 3 years' time, I'll graduate and be an eye doctor, an optometrist. Before we start, I've got this right here that was found on a Sunday market. And I want you to try and guess what this is. It's got obviously something to do with eye care by the nature of this video. It's a bit old, not sure if it's vintage, but it's quite old. You don't really see them like this anymore, but I'm going to try and guess what it is, and I will let you guys know at the end of the video. So I wanted to sit down today and talk about why optometry. I've been given this question by a few people and they've said, why optometry? Why have you chosen to do optometry? And I think I'm going to break this up into 3 parts. So first of all, why I chose optometry. Second of all, is it what I've been expecting so far? Granted, I'm in my first year of the degree. And third, where I hope to go with it in the future. So why optometry? Well, I think the answer is for a few reasons. The first one is just the type of profession, the type of career it is. I knew I always wanted to do healthcare. I knew I wanted patient interaction. I knew I wanted disease diagnosis, treatment, management, things of that nature. And so that narrowed down my career path into a couple of the more standard ones like medicine, dentistry, optometry, physiotherapy, things of that nature. Now, in terms of optometry, I mean, almost everyone has eyeballs. And that's not going to change anytime soon. As long as people have eyeballs, you're going to need eye care professionals. Not only that, but eye disease is getting worse. It's estimated by 2050 about half the world's population is going to be nearsighted. So there's an increasing demand for eye care services. On top of that, there's already an enormous eye care gap in Australia, the country where I live. 95% of blindness here is actually preventable, and we still have blinding infectious diseases such as trachoma, which my family was very surprised that are still in Australia when they moved here from the former Soviet Union, because some countries there, like Kazakhstan, have already eradicated them for many years. Optometry is also a very advanced profession. I mean, optometry 20 years ago is not the same as optometry today. Optometry in 20 years' time is again going to be very different. Optometry began as this profession rooted in jewelry making. Optometrists began as refracting opticians, where there was nothing medical, there was no healthcare, it was only dispensing glasses and refracting people's sight. And over the years, they've earned the right to use medical equipment, diagnostic drugs, therapeutic drugs, and that sort of scope seems to be increasing. They seem to be proving themselves much more useful than just glorified optical dispensers. Now in Australia there's talk of letting optometrists do certain kinds of eye injections, and in the US many states have legislated for optometrists to be able to do certain laser surgery procedures, certain minor surgical procedures with scalpels, things like that. Just because of the demand of eye care there is, and the fact that there is a profession there that can supply for that demand and do so in a safe way. Not only that, but the eye is an incredible organ. I'm definitely biased saying that, studying it, but it's the primary mode by which you interface with the world. It's integral to every aspect of everyday life. No one task that you're going to accomplish today or tomorrow isn't dependent on sight. If you can't see well, you can't work well, you can't play well, and you can't relax well. And in terms of well, I mean to the best of your capacity. The world is filled with things for our viewing pleasure, whether that be seeing the smile on your kids' faces, whether it's going to IMAX and seeing a 3D movie, whether it's painting or going to an art gallery, or whether it's watching movies or cooking the dish and with a certain garnish. All of these things rely on your ability not only to be able to see, to interact with it, but also to be able to see, to appreciate it better to a more full extent. In fact, sight is so important that around half your brain is involved in processing sight, which is just crazy. Not only that, but I didn't realize how diverse ocular health actually was. Your eyes truly are a window into your body. I mean, you can diagnose many systemic conditions like diabetes, high blood pressure, things of that nature. You can diagnose certain STDs. They have ocular manifestations like syphilis and herpes. You can find them in the eye. You can have, obviously, cancers of the eye, both inside and out. You can have presentations of different systemic syndromes or genetic conditions that arise in the eye. They may affect other organs and other systems of the body as well. And you can even diagnose certain brain tumors by the way they present in sort of ocular symptoms. It's crazy. There's even research now being done in neurodegenerative diseases like Alzheimer's or Parkinson's to see if there are maybe ocular biomarkers early on in the disease to detect it for early screening, which is incredible if it is the case, because so far the only way you can for sure diagnose Alzheimer's is post-mortem by cutting the brain open and seeing the plaques. I also chose optometry because of the diversity of work. I mean, most obviously you can practice as a clinician after the degree. You can work in independent clinics, you can work for corporate clinics, you can work in private practice. You can own your own clinic if you want to. So that's your typical seeing patients, screening them for disease, refracting them, finding their contact lens in their spectacle prescription, certain disease management and things like that. You can even carve out a little niche for yourself after graduating, such as working in pediatrics with kids or doing specialty contact lenses, which is a lot more complicated and is a lot more interesting than I was first thought to believe. This is the sort of thing where you're working with patients who've had corneal transplants or anterior diseases which misshape their cornea, like keratoconus or really, really bad astigmatisms. Ortho-K, which some of you might have heard of, is actually a specialty contact lens where they're trying to delay the progression of nearsightedness by designing a specific contact lens. And that's super interesting, this whole specialty contact lenses, because they do what's called a corneal topographical map, where they map your cornea, they see all the sort of the bumps and irregularities, and then they design a contact lens using reverse geometry to fit onto that and to correct it. You can also look into other areas of interest like a neuro-optometric disease, working with patients after stroke and traumatic brain injury, or diagnosis and management of other types of disease like glaucoma or retinal diseases. But you don't just have to work as a clinician. I mean, why not go into research, looking at ocular disease, or going into development of augmented reality headsets? I mean, they need eyes to work. I'm looking forward to the opportunity to volunteer overseas in outreach groups for people that really need eye care and can't get it. You can work in a medical clinic or hospitals, which in Australia isn't as common but seems to be gaining a little bit more traction because they're realizing how useful optometrists might actually be in hospitals. Actually, there have been studies done where they looked at optometrists triaging patients in hospitals, and they've decreased wait times and gotten rid of the sort of conditions that can be treated at a local eye clinic by an insane amount. It's actually crazy. I'll need to actually put the numbers up because I can't remember them now, but it's ridiculous. Okay, so what about my experience as a student so far? I mean, is it what I expected? First year has definitely sort of thrown me in the ring. It's been a little bit of a shock to the system. I did not expect there to be so many lectures. I didn't expect us to dive headfirst into the content. I'm glad it did, but it's crazy. I mean, you're expected to remember a lot and you're expected to learn a lot of skills. I'm very grateful that we started learning clinical skills straight from first year. We really sort of work with our hands a lot. And there's quite a lot of skills that we have to learn. There's a lot of equipment that we have to work with. The other thing is, compared to my undergraduate degree, the cohort here is much, much smaller. In fact, at the university that I'm going to, University of Melbourne, it's the smallest cohort of the postgraduate health courses. Some years had 40 students, some years have had 80 students, I think, on the higher end. So there's quite a range, but they're all quite a small cohort. And this definitely works in our favor. I mean, we know all the lecturers all know us, we know most of our classmates. And so it's very much a community that these are the people that not only you're studying with now, but in 4 years' time when you're working, they're going to be the other optometrists that you're referring to. They're going to be people that you might go to if you've got any questions for complicated cases and things like that. Not only that, but the research department actually at the university is one of the best in the world. You can definitely see that research trickling down into the lectures, especially from the departments like the optical physics department. The amount of optical physics we had to learn this year, much more than I expected. I did not expect to need to learn that much. Kind of glad that we did. I forgot that I actually enjoyed doing physics in my undergrad and in high school. A lot of it I feel like I won't need to use, such as we had to learn all the theory behind different types of telescopes, things like that. But a lot of it I can actually see myself needing the understanding for. For example, we had someone come into work the other day who was really nearsighted in both eyes. So he had -10 in one eye, maybe -9 in the other, super nearsighted. And for being nearsighted and being a very strong nearsighted person, you're at higher risk of certain things like retinal detachments and other conditions. And this patient actually had a retinal detachment, and this was a while ago. And so he had to be operated on, and it was such a large detachment that they couldn't use laser to fix it up. In the hospital, had to have a fairly invasive surgery to get his retina stuck back onto the back of his eye. Now, by the mere nature of doing this surgery, he was essentially guaranteed to develop cataracts in the eye that was opened up. And so he had 2 surgeries. He had his retina reattached, and then he also had a cataract surgery done where he got his lens taken out and a fake one put in. So it's quite an ordeal to go through. And at the end of that, he's got one eye that is still -9 and -10, and the other eye, which is essentially corrected to completely normal vision. And now for one reason or another, he didn't want to straight away have his other lens taken out and replaced. So he had this glaring difference in prescriptions for both eyes, essentially normal in one eye and very nearsighted in the other. Now you can't just prescribe glasses for that, because if you put them on your face, they're just going to fall off. And not only that, but the different amounts of magnification that the glasses would have on both eyes would possibly make him feel quite dizzy and result in something called anisoconia, which is a difference in retinal image size that's magnified onto the back of the eye, onto the retina, and that can mess with the way that you perceive depth perception, things like that. And so, what do if you can't prescribe glasses for that? What the optometrist ended up figuring out and ended up doing was partially correcting his script with a contact lens on one eye, and then partially correcting the rest of the script with just glasses. After some trial and error, they found that that was the best thing that worked with this patient, and so he walks around with one contact lens in his bad eye and then a pair of glasses to sort of correct the rest of his prescription. I think just the physics behind that is also really interesting, having to have the light bent 2 times as it goes into the back of the eye instead of usually once, just with spectacles or contact lenses. And so for that, they had to actually do a refraction and find his prescription while wearing a contact lens that was already partially correcting it. And so I thought that was just super interesting. Where, for the moment, am I planning on heading after I graduate the degree? I have definitely considered working partly as a clinician and partly as a researcher. I think there's a lot of interesting, wacky stuff going on, not only in ocular disease, but also in ocular treatment. Now we have OCTs, which are essentially like ultrasound cameras for your eye that can take a photo of all of the layers of your retina, which is an incredible diagnostic tool. There are just so many techniques and so many different ways they're used for different diseases that I think research in that sort of field would be very rewarding. Ultimately, I would like to practice to the best of my scope. I'd like to pursue an area of interest, whether that be specialty contact lenses or neuro-optometric disease or certain more complex disease managements. I know that next year we start some of our contact lens classes and some of those labs, so that'll be interesting to have a look at to see if I still have that desire by the end of next year. I'd also like to practice rurally for a bit. The more regional you go in Australia, the less eye care professionals there are. There's a great maldistribution of eye care professionals, both medical and optometric, and there's a very large demand there, so the scope and the responsibility you get is much greater. So you really need to know your stuff, and you need to know a lot of different kind of stuff, because you don't know what's going to come through your door. You don't know if someone's just come in because they've had a retinal detachment, or because they've got really high blood pressure and really high eye pressure as a result, or because they've got a little piece of metal that's flown into their eye because they've been working and they've been grinding metal without wearing safety glasses, and they've had a tiny sliver of metal fly off and go into their cornea, and then you have to remove that, actually using a little drill and little tweezers and needles and stuff. That's very cool. But I'm definitely looking forward to practicing to the best of my ability, I guess, in the future. With things like optometrists hopefully being able to administer certain kinds of eye injections in the future, I definitely consider being trained and qualified to do things like that. Alright, so in terms of what this was, if you guys guessed correctly, this is an eye cup. And essentially what that is you've got this little reservoir here that you would pour in either a cleaning solution or some sort of medication, and you put it to your eye, and you'd pour it onto your eye, and you would medicate your eye in such a way. So if you had some sort of medication you needed for certain eye conditions, you could put it in here and do that. If you've had some sort of chemical burn or anything like that and you wanted to flush your eye and wash it out, you could bathe it like this. Apparently it was used for kids quite a bit, and many adults use it as well. So this is quite an old one, and I think it'll make a fun prop in the background of some videos once I set up some sort of background like that. So that sums up why I chose optometry. If you're here because you're unsure what to do next year, and maybe you're considering optometry as an option, or you're not sure what to do in a few years' time, I hope this video helped you out. I hope it gave you a bit of a clear idea as to at least why I chose optometry and what I think I'm going to do in the future. Perhaps that might be mirrored in your thought process. If you guys have any questions about anything specifically in optometry or the course itself, feel free to put them down below, and I'll be sure to answer them. If you could like and subscribe, ring that little bell over there, it would really help out. It'd let me know that I'm doing something right, and it'd support me in putting out more videos in the future. I hope you enjoy your day. Bye.